want to show you here is that sometimes the skin cancer is located deep inside and has no connection with the upper layer, with the epidermis. This is the epidermis, below is the dermis. And if you look more carefully, this collagen is formed due to a scar. And the question is, what's causing this to form that way? Usually previous surgery, previous procedure. Well, in this case, there was no previous surgery, but there was radiation in that area. And in the past, and still in the present, people do treat basal cell skin cancer with radiation. The problem is that they don't know how deep it goes. And so they may treat it with a cream or with radiation on the surface, and they may leave a little nidus, a little bit something right at the base. And that something in the base will end up having harder time to resurface because of the scar tissue that we've reviewed, that we've discussed. And when you have that scar tissue around it, it's like a border preventing the basal from extending back into the surface where it usually originates, and instead it starts migrating deep into the muscle, into the vessels, and it can cause sometimes even emboli through the lymphatic tissue into other areas. So it's really important that you will take care of them. And this is actually a case where a wonderful physician, cardiologist, this is his mom, and he was wise enough to advise her, despite her age, to make sure that she'll take care of it in the most effective method, which is the Mohs surgery. So there are a lot of treatment options. It's not to say that one should avoid them, but one should be aware of all the limitations, risks, and benefits of each procedure and make sure that they are choosing the right procedure for the specific case. And this is actually not even on the face. This was on the neck/trapezius area. So it was right around this area here. It may look like nothing, which it did. It may look like you can just use a cream. And honestly, with all my experience, I did not expect that. I almost missed that. God wanted me not to miss that. And it's important. That's why most surgery is not 100%, because there's the human factor. You may be rushing. You may be not looking at that spot. I saw another basal cell somewhere else superficially, and I would have gone there and I would have left that alone. So it's really, really important. You take your time, you do it carefully. You have a wonderful histotechnician who gives you the edges around. A lot of variables that can go wrong. Most importantly, you have to treat them like you would have wanted to be treated yourself. Thank you very much.